Hello everyone. Today we are diving into OET speaking assessment criteria that are given on the official OET website. Hello, the speaking test is not just about how fluent you are in speaking, it is about how effectively you can communicate with the patient in real life healthcare scenarios. By the end of the session, you will know exactly what examiners are looking for and how to meet those expectations. So, what is OET speaking? OET speaking test involve two role plays. You will be the healthcare professional, and the interlocutor will act as your patient or sometimes as a caregiver. OET speaking is designated to test your ability to communicate in professional settings, to show that you can explain, reassure, advise, and talk to a patient. Your performance is assessed using two sets of criteria: linguistic criteria and clinical communication criteria. Let's break them down one by one. Linguistic criteria overview. The linguistic side focuses on how well you use English language itself. There are four key components: intelligibility, that can you be understood by the person you're talking to? Fluency, is your speech smooth or natural? Third point, appropriateness of language. That means, are you using the right word for the situation and the audience? Then the last thing, grammar and expression. Is your language varied, accurate, and clear? Let's look at each in more detail. First of all, intelligibility. It is about speaking clearly so patient can understand you. This includes pronunciation, your tone of voice, stress, like how you stress certain situations, and your rhythm. For example, imagine you are explaining a new medication to the patient. If you mumble the name of drug or you speak in a flat tone, the patient might not trust or fully understand you. And let's just assume when you have to empathize with the patient, like when patient is talking about their symptoms, like they have these complaints or they have these symptoms. So at that moment, you have to show the empathy immediately. So if you show empathy in a tone that is flat, like you say, I'm sorry to hear that, and you say it in a very flat tone, so it will be a negative point. So you have to manage your tone as well. Like you have to say, oh, I'm so sorry you have been going through this, I understand it must be very uncomfortable for you. And you have to say it with a very empathizing tone as well, so it shouldn't be looking that you are just doing the empathy like a formality, or you don't have to be robotic. And lastly, the transition between the tasks should be smoothly. Let's have a look at how a role play cards look like. This is how a role play looks like. It has several tasks you have to do, and by intelligibility, I mean that you have to transition from one task to another very smoothly. Like you have to complete one task and then you will move to next task. That is transiting between tasks smoothly. Next is fluency. Fluency is about speaking smoothly at the right speed without constant hesitation. You don't need to sound like a news reader. You should take pauses because natural pauses are fine. In fact, they are helpful. But avoid longer silence or filler words like ah, like do not use that too often. For instance, when you are giving a bad news or explaining a rare condition to the patient, slow down slightly, take a meaningful pause, and let the patient absorb the information. Like when you're explaining them something, take pauses so that they can understand that, like whatever you're explaining them as well. Like let's say when patient shared his symptoms with you, so you'll be saying thank you for sharing your symptoms with me. Then you will give a pause. Let me do it. Thank you for sharing your symptoms with me. It seems like you have a condition called conjunctivitis. Does this sound accurate to you? Or you can say, have you ever heard about conjunctivitis? So you have to take a bit pauses between them. That's fluent and that's natural communication. Then appropriateness of language. Here examiner check if you are using words and tone that match your listener, like who is listening. So if you're speaking to a patient, avoid medical jargons. Don't say medical terminologies like telling a patient you have GERD. So they might not understand it. So you can say you have acid reflux, stomach acid coming up, which cause heartburn, like that. So tailor your language specifically to patient. Simply adapt tone that suit patient. Okay, so next is grammar and expression. This criteria look at your vocabulary and grammar. Like, are you using a variety of expressions? Are your sentence accurate? Let's have a look at the task. So, yes, this is the task of patient that he is anxious and upset because he has to attend daughter's wedding, and he is worried that he might end up spoiling daughter's wedding's photo. So you have to reassure the patient that redness will go away before the wedding if they will use these eye drops. So you will be applying to patient, it will go away. The redness will go away. It should resolve soon. The redness is expected to clear up in a few days. So you have to use a variety of expressions. If you have to reassure the patient again and again, you will be saying differently. You will be using a range of vocabulary. Clinical communication overview. Now let's look at the second major criteria, that is clinical communication criteria. This is where OET checks if you can truly interact with the patient, not just talk at them. So it includes relationship building, understanding and incorporating patient's perspective, providing structure, information gathering, and information giving. Let's have a look at them one by one. First of all, relationship building. This is the heart of patient communication. I'll say it again. This is the heart of patient's communication. So this is very important that you connect with your patient from the very start. And how can we do it? The key is to show empathy. Show that you genuinely care for them. Let's see how can you do it from the same role play we've been discussing about. So at this point, patient came to you and he told you that he had a red, red, itchy, watery eye. It has a grit in it, and it is very irritated and watery, and he has to attend daughter's wedding in a few days. So he was being very worried. So what you will do at the very start? So you won't be saying straightforwardly that your condition is red eye or something. So first of all, what you will do at the very start, like this is the key, mark my words here. Like whenever patient told you some complaints or some symptoms, what you will do, you will immediately empathize with them. You will be saying, oh, I'm so sorry to hear about your condition. I understand it must be very uncomfortable for you. Or I'm so sorry to hear about your condition. Like anything you think you can empathize with. But your tone of voice should also be very much like that. It shouldn't be robotic. For relationship building, some people do, they ask the name of patient and they think it builds relationships. Maybe it does, but for the most part, and according to the OET assessment criteria, showing empathy builds the relationship best. My tip for relationship building is that assume yourself as the most empathetic person, like most empathetic nurse, most empathetic pharmacist, most empathetic doctor. So when you think like this, you can empathize very much perfectly with the patient. And when you empathize with them, it builds trust immediately. Trust me, nothing builds relationship more than empathizing with the patient when they tell you about their symptoms. It will show them that you genuinely care about them. And then understanding patient's perspective. This is about actively listening and reflecting the patient's concerns back to them, using their words into your response. Let's take it from this similar task when patient was worried about the photos on the wedding day of the daughter. So you reassure the patient, I understand you're concerned about your daughter's wedding pictures. I understand it's a big day for your daughter. So it will show that you were actively listening to them. So when you are able to display this thing that you were actively listening to the patient, you build relationship with them. And one more thing you have to do, that you have to be very non-judgmental. Relationship can be built in three ways: showing empathy, understanding patient perspective, actively listening to them, and being non-judgmental. Like let's assume when a patient told you that I do not want to take this medication because it makes me sleepy, but you know that medication is very important because it is to regulate their blood pressure. So you cannot just say, oh, you have to take this medication directly. Like it will sound rude. And it will also sound like that you don't understand and you do not care about patient feelings. So what you will say, I understand that you do not want to take this medication as it makes you sleepy, but I cannot stress you enough that it is very important that you take this medication regularly because your blood pressure needs to be regulated. So first of all, you have to understand what they said. You have to respect their perspective. Then you will put your perspective. So it will show that you are being non-judgmental towards the patient. So when you will be non-judgmental towards them, they will open up more about their worries. So you have to be non-judgmental, and this also build the relationship. Next is providing structure. This is my favorite. Like how you will perform a task. You have to perform your task with a great structure. So first of all, when patient will say something, you will acknowledge their words, like whatever they have said. You will acknowledge their words when you say, I understand your concerns regarding the pictures of your daughter's wedding. So that's what you do. Well, first of all, you will acknowledge their concern. Then you will do your task that is given in the script, that I would like to reassure you that if you use this medication, your redness will go away, and whatever given the task, you will do the task. And then at the end, you will ask a question. How does this sound to you? Like you will ask a question. So you will do every task in this structure. First of all, you will acknowledge. Second, you will do your task. Third thing, you will ask a question. Keep the conversation clear and logical. Then about information gathering and information giving go side by side. So main thing is here that you have to ask patient a lot of questions. Like whenever you think you can ask patient a question, ask it. Like ask open-ended question. At the start, you can ask patient to explain your symptoms more so that you can understand their condition more clearly. You can ask them when did this symptom started, and if they say they're using any medication, you can ask them about how long they've been using it. And if they say you and if you have to tell them that they have this condition, that they have a red eye, so you will first of all ask them, do you understand, like let's say you will tell them, thank you for explaining your symptoms. From your symptoms it seems like you have a condition called red eye. So before explaining the condition, you will say, you can say it like this, like, have you ever heard about red eye? Like you just asked a one open-ended question. So when you ask open-ended question, it makes the conversation look like you are engaging the patient as well, so that you are trying to involve them in the conversation as well, so that they can also participate in the conversation. Finally, you will give information. Make sure it is clear and check that patient understands. Explain one point at a time, then take a pause and then ask the question. To sum up, the OET speaking test is not just to test your English, it is about how well you can communicate in a healthcare setting with the patient. Master the linguistic side, speak clearly, appropriately, and accurately. Master the clinical side as well, empathize, build your structure correctly, and truly connect with your patient. When you combine these, you don't just pass OET, you demonstrate that you're ready to be a world's best class healthcare professional. Thank you for joining me today. If you want detailed feedback or live practice for OET speaking, keep practicing these skills daily and seek feedback whenever possible. If you want feedbacks with me, you can register on our website